Hi, everyone, and welcome to today's webinar, Leading Simply in a Complex System. My name is Tamara Moore with the Reese Group, a communications firm in DC. I will serve as today's moderator, but before we get started, I'd like to go over a few items to help you participate in today's event. We've taken a screenshot of an example of the attendee interface. You should see something like this on your own computer screen in the upper right corner. If you have joined today's webinar by telephone, please enter your PIN number, which can be found in the audio pane of this control panel. All attendees will be placed in listen-only mode. You will have the opportunity to ask questions during today's discussion. To ask a question, submit your text question through the Q&A section of your attendee control panel. We will collect all questions and address them during the Q&A session at the end of today's presentation. If you have a question or issue with the webinar technology, you may type your question through the Q&A section of your attendee control panel, and someone will respond to you as soon as possible. You may also contact GoToWebinar technical support by dialing 888-259-8414. Today's presentation is being recorded and will be posted to the Leadership Program website in the coming days. I'd now like to turn the call over to our host today, Dr. Adam Perlman, Director of the Leadership Program in Integrative Healthcare at Duke University. Adam?
Thanks, Tamara. And thank you all for joining us. The Leadership Program in Integrative Healthcare at Duke University was established really with a straightforward goal to develop leaders throughout healthcare and in various healthcare settings who would be really equipped to usher in a transformation of healthcare in line with the principles of integrative health. What we've seen so far from the participants has really exceeded our expectations, and we've had a very diverse group in the first three cohorts. We've had physicians and administrators developing and running integrative programs. We've had CFO from a large healthcare system in Alaska. We've had the head of HR from a bank. We've had health consultants. We've had other providers and practitioners, and really a wonderful, very diverse group. And we are currently accepting applications for the fourth cohort of the program that begins in February of 2018. You see some information up on your screen, but you can find more information about the program itself or access what's really a brief application at www.integrativehealthleaders.org, as it says up on the screen, or you can contact the program manager, Damien Galina, at his email, damien.galina@duke.edu. Next. Now, I am very honored to introduce one of our immensely talented core faculty members for the leadership program, Lori Knutson. Lori's experience as a clinician and healthcare administrator, truly dedicated to the advancement of integrative healthcare, spans more than 25 years. She currently serves as the Administrative Director of Integrative Health and Medicine for the Meridian Health Care System in New Jersey. There, she's established and grown the healthcare system's model and practice for integrative healthcare. Today, however, Lori will be presenting on leading with an entrepreneurial style. And with that, I'd like to turn the call over to Lori. Lori?
Thank you, Adam. I'm pleased and honored to have this opportunity to be on this webinar and share a framework and a method and a social technology that I've used in my work in bringing integrative health into very complex healthcare systems. I did want to just comment, the title of our webinar is Leading Simply in a Complex System, and I have to say I'm not sure that this will help you to lead simply. It may help to simplify some leadership, but it really is a brief overview, and hopefully it will just spark some curiosity about this model and how you might actually engage in using it. The first slide that you see here, this is our current system of healthcare in the United States. Not a simple roadmap for those of us in healthcare, let alone for those seeking healthcare. If you look at the lower right side, you will see patients. It's in a star format. And if you look to the far left, you will see physician. So if you draw a line between the two of those, you're already seeing this disconnect. If we talk about patient-provider relationship, our system of healthcare does not show much of a connection there. And then above that is really the overhead, and that's the complexity that I'm going to speak to today, and a theory and model that we can use to sort of traverse through that within our own system. Next slide, please. So I just want to cover a few of the things that we probably, if you are currently in a healthcare system or in healthcare, you have some way been shaped by some of these. And these are really the external things that are impacting healthcare systems and healthcare providers. And you probably are well aware of some of these. These all came out of the Accountable Care Act, or Obamacare as it's been called. But we have our ACOs, our care integration networks, meaningful use, health grades, HCAP scores, which now have a monetary value for reimbursement. Obviously, the idea of AAA, which really all of these processes are to reach AAA, which is improving the quality of healthcare and improving the experience as well as decreasing costs. And then we have value-based contracts, total cost of care, and other things like population health and payment systems in place like MACRA and MIPS. So this is the external environment of complexity that's imposed on health systems and providers. And so many of you are probably feeling this currently. Next slide, please. And then we have complexity within the systems of our systems. So within our large healthcare systems, we have our hierarchies, and actually these hierarchies continually change because we are actively seeing mergers and acquisitions and affiliations, all of which have impact on our internal cultures. We obviously have our formal leaders and our very important informal leaders. In the integrative healthcare world, sometimes these are the folks that you really need to have the connections with to move through a system with some sustainability. And then, of course, there are department silos and clinical silos, because we have, in many cases, service lines, and obviously the unspoken cultural norms. And all of these lead to, obviously, the complexity of bringing in a new model of integrative health, and to try to bring this across the system and make it sustainable. We really have to understand how to lead up, how to lead down, and how to lead bilaterally, which can sound a little exhausting. Next slide, please. So I just want to take a minute and talk a little bit more about organizational complexity using organizational development framework. And the reason I want to touch on this is because I think sometimes we can feel the enormity of the complexity, and on any given day it can exhaust us. But I think if we can peel it apart and realize what we have locus of control around and what we can influence and what we can't, makes it a little bit more simple for us to move through it. So there are really three types of complexity. There's dynamic, social, and emerging. And we're going to look briefly at each one of these. Next slide, please. So dynamic complexity is defined as a systematic distance or delay between cause and effect in space and time. It sounds very theoretical, but if you just take the example of global warming, that didn't happen yesterday. It happened over a period of time, and it happened because we weren't necessarily conscious of the human involvement in global warming until it actually appeared and has now become a very complex situation for us to begin to handle and respond to. Another example might be our current healthcare challenges, and this is very current because, as you know, we are looking at changes or repeal of Obamacare, and it really doesn't matter what your stance is, a political stance is. When we repeal the healthcare system that currently is in place, we will see an effect over time. Some things we will see that we know will come, and some effects that we won't know. And more on a personal level, more on an individual level, we can think of complexity, dynamic complexity through chronic disease. Again, chronic disease and the prevalence of chronic disease did not happen overnight. It took time for that to elevate and for us to be conscious of it, and then to be able to do something about it. Next slide. The next type of complexity is social complexity, and we are all impacted by this every single day. But again, if we stay in line with the example of global warming and look at CO2 levels as a cause of global warming, this is a multinational issue. So there are worldviews, there are many stakeholders, and it's not just countries like the US or China, but it's businesses and it's individuals within that. So this is that social complexity. And again, if we look at our current healthcare situation and the repealing of our current healthcare and looking at the introduction of the new American Healthcare Act, this has huge social complexity because it involves government programs, private insurers, businesses, and citizens. So as a social element, there is a great deal of complexity that we need to consider in this change. Next slide. And the final one, which I think is probably the most challenging, is emerging complexity, and that's characterized by disruptive change and has the three following characteristics. The solution to the problem is unknown, the problem statement itself is still unfolding, and who the key stakeholders are is not clear. Once again, if we just take a look at our current political and social situation and look at some of the emerging trends that we're seeing politically, we now have a leader of our country who has used the application of social media to inform the country and the world about U.S. politics. That has created a definite disruptive change, and this is a defining principle of an emerging complexity. So when we look at the three of these forms of complexity, and we think about the dynamic, the social, and the emerging, this is absolutely applicable to what we need to deal with when we're bringing integrative health into a complex system. Next slide, please. So this can actually feel, if it doesn't already just in this short definition, a little overwhelming. We can sometimes find ourselves very confused about the direction in which we should take integrative health within our systems. We might feel isolated, or sometimes we just feel purely in the dark about where we should be going and who we should be doing what with and when. But there is a way through the maze. Next slide. The theory that I'm talking about today is called the Theory U. It's a framework that provides guidance and tools that empower us to lead through our current healthcare complexity. The Theory U proposes that the quality of the results we create in any kind of social system is a function of the quality of awareness, attention, or consciousness that the participants in the system operate from. Some of you may be thinking, I can't control how others act or in a situation or a system, which of course you're right. However, you can effectively influence them by how you show up in the system and the work that you're doing. Next slide. Otto Scharmer, who has a PhD in organizational development from MIT, is the author of Theory U. He's also the founder of the Presencing Institute. Otto is a senior lecturer at MIT and co-founded the MIT UX Lab, where over 75,000 people from more than 185 countries are actively using the Theory U for innovations to solve and resolve social, environmental, and political challenges. Next slide. So this is the broad, high-level visual of the Theory U. And it focuses on shifting the inner place from where we operate from. So if you look at the middle section where it says the open mind, the open heart, and the open will, this is where we allow ourselves, once we become aware of these three elements, to be present to what wants to emerge. So the whole idea of the Theory U is that we are leading from the future as it emerges, which really speaks to that last complexity that I talked about, emerging complexity. And it aligns with where, how, and when we integrate integrative health within a system. Now, this might sound very theoretical. However, the Theory U incorporates practical methods and tools. Unfortunately, in this brief webinar, we aren't able to go into all of the tools. So I encourage you to actually take a look at the Presencing Institute website so that you can get more in-depth around the framework, the methods, and the actual tools that are used to move through the Theory U process. Next slide, please. One of the defining factors of the Theory U is that leaders begin to look at self. And as we all know in integrative healthcare, we talk about the provider as an instrument of healing. We know that when we're with our patients, that who we are and how we are, our beingness, if you will, has a great impact on the outcome of that patient and the healing. That is absolutely true and applies to leadership. And so as we think about the blind spot is really about our own beliefs, our values, and our attitudes and our actions. And we often think in leadership, we're always driving towards results. And if we just think about, for example, the triple aim, we know the results are we want lower costs, but we also want higher quality, and we want a great patient experience. We saw from the slide all of the components that have been brought forward to get us to those results. But the question really is, as leaders, who are we in bringing that forward? And that's so true about being able to bring integrative medicine, integrative healthcare into complex systems, knowing what we've already described in the complexity of what we're dealing with. Next slide. So Otto talks about, and the Theory U talks about this concept of presency. And this is where we begin to really understand who we are and how we are being in the work that we have come to do. Presencing is a blend of the word presence and sensing. I will tell you it came from a gentleman back in the 17th century, so this is not a new concept. And it is the ability to sense and bring into present one's highest future potential as an individual and as groups. So it's really an intuitive component, and it's active. It's not a static sense of being. The Theory U offers both a new theoretical perspective and a practical social technology, and suggests that the way in which we attend to a situation determines how a situation unfolds. So I attend this way, therefore it emerges that way. The Theory U offers a set of principles and practices for collectively creating the future that wants to emerge. And we're going to walk through a little bit more of this. Next slide. Basically, there are three primary movements in the Theory U. And again, this may seem more theoretical, and I will also say it is not linear, and it doesn't happen just once. This is a repeating component that I can honestly tell you personally I've done over and over and over again as I move through systems. So the first movement is on the far left, and it really is about observing. It's developing awareness through observation, and it's a time of gathering information about yourself, what pushes your buttons, what are your beliefs and values, as much as understanding others. In the Duke Integrative Healthcare Leadership Program, we talk about informed mindfulness, which really is this same thing. Informed mindfulness talks about self-awareness and then having the skills of self-regulation. And then as we move through to the bottom, where it talks about retreating and reflecting, once we really understand and we have the sense of self-awareness and we have the awareness of others and how they're being in their work, it is really time to retreat and begin to look at what we have found and observed and allow sort of this inner knowing to happen. And practices such as mindfulness can allow for this sort of emerging to happen. This is a time of creativeness and inspiration, and it's really a time to ask the question, how do we become part of the future story rather than holding on to the story of the past? Once we come through these two first movements, we begin to find ourselves opening up and seeing differently and moving out of our own belief systems and values. And there's almost a shift in energy, almost a shift in speed. And we begin to see opportunities and potentials, and we actually begin to draw the resources and people to us. So there's less effort, and that is really where we get into some of the simplicity that happens. It's also a time to begin to act. And so it's a time to explore the future by doing. So in essence, that's a time of prototyping. And there's a company called IDEO. If you're not familiar with IDEO, that is exactly what they do. They help organizations really think about prototyping from a new space. And then there's also something called human systems design, which is reflects some of what happens in this Theory U 3-movement process. Next slide, please. We'll go a little bit deeper into this to help you kind of understand more about the process and what comes out of the process. If you go to the very top left side where it says downloading and past patterns, this is really where that blind spot is and where the opening needs to happen. So if you're going to be successful in being able to really infuse a system and in some ways actually transforming a culture to one that has the principles of healing and wholeness, you have to begin the process within yourself. And so as you move down this left side of the U and you begin to suspend your old patterns and you begin to see with fresh eyes and you can sense what we call the field or the field of opportunity, we also come up against something. We come up against the voice of judgment, the voice of cynicism, and the voice of fear. And the idea is not to ignore those, but to actually jump fully into those, because that's the process that will begin to free you from your old beliefs and values. Once you are able to do that, you sort of drop the old baggage and you actually can get into this place of what we have already called presencing. And this is connecting to that inner source. It's really understanding who you truly are and what your work truly is. And when you really know that, leadership just becomes a way of being. And as you move up, that's when you begin again to start to prototype the new, and you begin to truly embody and perform in a system as a whole person and a whole leader. Next slide. We also take this application not only to the self, but we take it into the organization as a whole. And I'm going to talk you through an example that I've actually just recently walked myself through as I've been in this organization. And just for reference, I've been with Hackensack Meridian Health for just a little bit over a year. So all of this I'm actively applying. So this is not just theory for me, it is putting theory into action. And so as we know, as integrative healthcare leaders and being in complex systems, nothing can be accomplished in isolation. Our success and our sustainability occurs through co-creation and co-ownership. And so I'm going to just give you an example of one of the things that I have been in the process of doing for over 9 months now. And I'll talk you through these 5 stages of the process. I early on knew that one of the components or one of the things that we wanted to be able to accomplish was to influence inpatient services within the hospitals. It's a large system, and we have many hospitals, 15 hospitals across a very large geographic area. And then we have multiple service lines. We have cardiovascular, oncology, neuro, behavioral health, women care, peds, and a few others. And so in order for me to even begin to think about what we were going to do in the way of integrative health and integrate and be successful and sustainable, I first had to think about how I was going to help uncover a common intent. So I needed to look across the board with my colleagues and say, what is that common thing? I have limited resources, but yet I need to make an impact that will be something that they can't do without. That's where sustainability comes into play. So I started that by actually meeting with all the service line executives one-on-one using a tool that Theory U has called stakeholder interviews. And no, I don't pull out a piece of paper that says stakeholder interviews. I just basically have casual conversations with people about what's important to them and where they feel gaps are happening, and perhaps where they feel they have no place to go. And we want to be that element that can help them be successful. And in that, I go to where they are. I go to where they work. I go to where they're seeing their patients and where they're leading their people. So I get a sense and I can observe what's happening in that environment. And then through that, and that took me about 4.5 months to go through that process of meeting everyone, again, because there are multiple competing agendas for time with people. And I did that, and then I came back and I said to myself, okay, what did I learn? And that was the time for mindfulness. That was the time to really evaluate and be part of that informed mindfulness practice and begin to understand what was possible. And what we came out with was the idea that the common thread across all service lines was pain, and that's no surprise to the integrative health field. Pain in the hospital and outside of the hospital is an underserved and complex area. And so I brought all of the service line folks together one evening for dinner. I presented what my findings were to all of them. I got their engagement and their understanding about the direction and what we possibly could offer. And then I provided them with 3 possibilities. One of the things that I heard from them with pain was patients didn't participate in their pain management. 2, nurses weren't well equipped with non-pharmacological interventions to help their patients. And 3, we really needed to employ evidence-based interventions that weren't currently being employed in the system. So I presented to them 3 things to address those. 1 is a pre-hospital program that we're starting for patients we are launching. It's called PREP, Pre-Hospital Resilience Empowerment Program for patients coming in for surgical procedures. The second one is training nurses in integrative and holistic practice with 3 complementary therapies they can apply at the bedside. And we are also launching that in the fall. And finally, I'm working with the medical staff at all of the hospitals to get licensed acupuncturists credentialed. So that's the intervention that will be used to help support that acute care pain experience for the patient. So we are prototyping these, we are co-creating as groups, and we are literally trying to embody a new way of being and doing around a very critical indication for our therapies, which is pain. Next slide. I do want to just touch briefly on the sort of mirror opposite of what presencing is, because I think this is an important thing for us to think about. When we get into downloading past patterns, which often happens, it happens to all of us because we have those days where we're tired and it's difficult to deal with some of the things that come at us. But what happens to us when we look at the 3 elements on the open mind, open heart, and open will is when we start to look at the open mind, but we get into the absencing side of things instead of the presencing side, we get stuck in one truth, one view. And when we look at the open heart and absencing, it actually is that we get stuck in one skin. It becomes an us versus them identity. And then finally, with the open will, the opposite being stuck in oneself, that we are the all-powerful. And those identities, those values, those beliefs, and those practices lead us into a downward spiral. And there's a great book that all of my team currently have in their possession and read, and it is called The Power of Collective Wisdom and the Trap of Collective Folly. It's written by Alan Briskin and a few other authors, and I recommend that as a tool to help people understand both of these sides of the sort of same coin. Next slide, please. So one of the tools that is in the toolbox of the Theory U is something called the steps of system sculpting. So honestly, what we are trying to do in healthcare systems with integrative healthcare is to sculpt a new way of being and doing and providing care from a holistic and integrated perspective. We won't walk through each one of these, but I actually use this on a fairly often journaling basis, and it is to walk through these 6 questions, and you do it sort of backwards through the U. But when you think about these things, and you think about the first question, what do you love, and what are your sources of energy? When you are depleted of that, you have no way to move beyond that. You can't move through the U process. You cannot be a good leader if you are depleted. And so that very first thing about understanding your source of energy is so important, and to actually write those things out so that they become meaningful and you can see your evolution over time. So I encourage people to really think about these system sculpting steps to sort of walk you through a practice of your own. Next slide. So as this has been a very brief overview of a really practical theory and method and framework. And what I'm really hoping that you will take away from this, at least a piece of it, if nothing, a seed that has been planted for you, is that the Theory U will help you to develop a personal practice where you really can begin to quiet your mind, open your heart, and begin to strengthen your own internal sense of will to be a good leader. That you will know that how you show up plays a big part in what transpires as you begin to or you are leading through a system. And third, that integration and sustainability is a co-creative process. We cannot do this in isolation, and we can't be activists. We really need to be co-creators. Next slide, please. So I will end with this, and I think this is something for us to really embrace as leaders, that oftentimes we get caught in this idea that our job is about creating vision, goals, and direction. And yes, that's true. But more profound than that, our job as leaders is to help people discover the power of seeing and then seeing together. I thank you for this opportunity to provide this very brief overview of the Theory U and some of what we're dealing with in complexity. And I hope in some ways this has helped. I think we can now open it up for questions.
Thank you, Lori. That was great. We have a few questions in the queue, and as a reminder, I'd like to invite everyone to ask a question. You can submit your text question through the Q&A section of your attendee control panel that is on your screen. Our first question is on team buy-in. Does Theory U require buy-in from your broader team to be successful? And if so, how do you pursue that collective model?
That's a great question, and what I would tell you is it's not that the broader team needs to have buy-in, because the Theory U is about a way of being and doing. So as you lead, the buy-in should actually become organic, because it's being done through the way in which you are practicing this model and again, the way in which you are being a leader. So the buy-in should begin to be seen sort of in an organic way, because people will begin to co-create with you. If they're not, then you probably are not emitting the theory and the framework and the aspects of presencing in the way that I've offered up to you. So it's not necessarily about a buy-in, it's about really demonstrating through action.
Great. Our next question is about obstacles. What have you found to be the biggest obstacles in breaking through healthcare's inherent organizational complexity?
Well, I think the first couple slides were a good example of some of the barriers, but I would also tell you there's so many competing agendas right now, and unfortunately, because healthcare has obviously become a business and a very important business from a national perspective, individually as leaders, we get pulled in 1,000 different ways, and oftentimes we're trying to help people with other agendas. And so I think that the hard part is sort of being able to get the attention of your coworkers. And the way that I actually try to do that, and I think I do that, is by putting myself in their place. I try to be on committees and task force that are about the organization and not necessarily just about integrative care. I have to be seen as a participant in other people's agendas as much as my own.
Okay. And Lori, someone's asking, can you give us an example of the power of seeing and seeing together?
So that actually is this idea, well, it's not just an idea, the seeing is this process of the Theory U. So the idea of first observing self and self-awareness is the internal seeing of self. And then as you bring that forward and you go through this process of co-creating, that's where others begin to see. So it's in those actions of the Theory U that the seeing of self and others begins to happen. And again, it happens organically. It doesn't necessarily happen in 3 linear steps. It is truly a process that happens.
Great, and we have a few more questions, but before we ask, we will have time for more questions, so if there are any questions, please enter them through the Q&A section of your attendee control panel. Lori, one question. What are 3 integrative therapies that you initiate in patient care, and how do you delineate roles within nursing?
So if we're talking specifically around nursing, the 3 therapies that staff nurses are being trained in are aromatherapy, guided imagery, and some touch therapies like reflexology. If we're talking about specialists of integrative healthcare, not only do we have integrative medicine physicians and nurse practitioners, but we also have nutritionists, acupuncturists, health psychologists, and health coaching. So they're the therapies that we integrate into our conventional providers, as well as the things that we do as specialists. And the second part of that question was?
How do you delineate this role within nursing? How do you roll it out?
Well, so what we're doing is we're using an already evidence-based training model that we're employing with the nurses, and we are doing it by developing first champions at each of the hospitals. So we are looking for what I call sort of the low-hanging fruit, the nurses that already have a high interest in holistic nursing and integrative therapies. Those nurses at each of the hospitals then will become the people that will help us fully integrate into each of the nursing units and within the service line areas. So it has to be very strategic. It has to be evidence-based. We have to have ways to integrate this into EPIC, the electronic health record. And, you know, again, you want to start with some ease and grace, and so you always start with people who already have an active involvement in not only the idea of holistic or integrative, but may already be practicing.
Okay, great. And what is the name of the book that you assigned to your team to read?
Yes, it's called The Power of Collective Wisdom and the Trap of Collective Folly. And the main author is Alan Briskin, B-R-I-S-K-I-N.
Great. And one last question that we have in our queue. How can people best sense the source of the U process? So in particular,
mindfulness. The way to do that, to really get to that place, and I think those of us on the call, on the webinar, who have been in the integrative world, we understand that mindfulness gives us that space. It's the space where we no longer have our own judgments or our beliefs and values, but we let go of all of that, and it is a quiet space where we find that connection to something greater than ourselves. And that's really the energy that infuses our ability to be creative, inspirational, and vibrant leaders to move up that other side of the U to begin the action of prototyping and embedding and embodying.
Okay. How can integrative health coaches play a part in inpatient and discharge treatment plans?
Great question. We're just working on this ourselves. So we're just starting the nurse health coach. So we've chosen on the hospital side that our health coaches need to be nurses. And we did that because we believe that qualification of having hospital experience as a nurse is important both from a patient medical perspective and understanding the conditions that the patient might be experiencing from a health and medical perspective, as well as being able to have the language to speak with physicians and other nurses about what is going on with the patient. So we decided to have health coaches who are RNs, and we're actually starting again upstream, well, at least upstream from a hospital admission perspective, with this PREP program that I briefly described, which again, the acronym stands for Pre-Hospital Resilience Empowerment Program. And that's basically where the health coach, the RN health coach, will help the patient understand the mind-body connection, inform them and teach them around some mind-body skills, and help them to be an active member in their pain management. So that's on the front end side of it. I imagine as we begin to work closer with our care transition teams and our care management teams and our nurse navigators, that we will also bring components of that into that care transition. So not only the pre-hospital perspective and the inpatient perspective, but as people leave the hospital, to understand that the skills that they've learned are lifelong skills. They aren't meant just for the hospital experience, but truly to empower them in healthy lifestyles afterwards. So we have a multitude of different care transition teams and members that I'm already actively involved in engaging in that conversation with.
Okay, we've got a couple more good questions coming up. Where can people learn mindfulness related to U theory? Which evidence-based practice best supports that in integrative behavioral health?
Yeah, you don't necessarily have to think of mindfulness as merged with Theory U. Mindfulness is a tool that helps you get to that presencing space. And so I think any form of mindfulness, if you haven't been trained in it and you want to begin that process, there are even online opportunities to learn mindfulness skills. And the very basic component of that is being able to literally sit and not get distracted by your thoughts, but go internal and just be present with what is. And that does take practice. It is a practice. It's not a one-time experience by any means. But it definitely helps you to get to that place of presencing or being present and sensing what wants to emerge as a new model.
Okay. And from a business perspective, many people find the integrative health service is not cost-effective or profitable. How do you manage your business model?
Well, that's a whole other webinar, but I will tell you briefly that you have to think about a very full portfolio of opportunities to demonstrate the return on investment. And I'm not just talking about dollar return on investment. So we look at several different things. One, we do have an outpatient clinic. As many of you on the phone who might have know about outpatient clinics, they aren't necessarily a profit-driving machine. So the clinic is one aspect. It is a value add for people. Part of that is demonstrating that as healthcare is looking at how we keep people healthy and not just how we treat people when they have disease or illness, we become the partner to primary care and helping them optimize the patient's capacity to really learn healthy behaviors. But we also look at from the inpatient perspective, beginning to have the conversation around how we are a support service to the hospitals and to the service lines. And so if we are helping, for instance, our first indication around pain, if we're actually helping to reduce pain in the hospital setting, there is an economic value to that. One, patient HCAHPS or patient satisfaction scores begin to increase, and there are ways now to validate that. We can also talk about, as we train nurses in bedside complementary therapies, what that does for engagement and retention of nursing staff. There's an economic value to that. We are also looking at, we just did our first round of bundling our services in the new bundled care models. So that's another way to be able to look at economically having coverage for these services across an episode of care. But the main point is, don't think of one way. You really have to look at what is the system being required to measure, and how are they acquiring revenue, or where are they looking at to minimize costs? And that's where you have to become very strategic and planful. The only way you do that is being in the system and finding out from leaders what's going on and where their needs are.
And one last question before we wrap up today's webinar. Do you have any suggestions on how best to identify or hire personnel that potentially enhance a collective work environment, or what to look for with an open mind, open heart?
Yeah, that's a great question, and it's on my mind every single day and every time I do interviews with people. And quite frankly, as we filter through applications of people and we get to people that we know probably have technical experiences, what's most important to me is that a person can articulate their sense of self, their sense of being in their work, and how they can co-create with others. And I literally have those conversations with people because it really is about their way of being that will make the biggest impact and success for us in this co-creative initiative that we have to do.
Thank you so much, Lori, for taking the time to present on today's webinar and to answer all these questions. For those of you with questions that we did not get to, we will respond via email. This concludes today's webinar. A recording of this webinar will be posted on the Leadership Program website, www.integrativehealthleaders.org, by Friday afternoon. If you have any questions about the program, I'd like to reiterate that you may contact Program Manager Damian Galena at damien.galena@duke.edu with any questions, and we are accepting applications for the 4th cohort to begin in February 2018 with the application deadline of September 30th. Thank you all again for your attention, and have a pleasant day.